Today, I will talk about a homeopathic topic, seizure disorder. It is a case study. Seizure disorder homeopathy treatment through my BrainMindia protocol. This case study highlights the successful treatment of a 17-year-old male patient with seizure disorder using my BrainMindia protocol over 14 months. Yes, it took around 14 months. Seizure disorder, also known as epilepsy, is a neurological condition with recurrent and uncontrolled electrical imbalances, disturbances in your brain. Conventional treatment often involves anticonvulsant medications, but homeopathy offers modern and holistic approach that aims to reduce seizure frequency, enhance neurological stability, and improve overall quality of life. Before starting the treatment, the patient exhibited the following symptoms: frequent seizures occurring 2-3 times a week, lasting 30 to 60 seconds. Patient experienced loss of consciousness, momentary blackouts during seizures, and also he had post-seizure confusion, disorientation, and drowsiness post-seizure. Muscle stiffness and spasms, involuntary jerk movements were also observed, along with irritability and fatigue, reduced energy, and emotional instability. I need to say about some management. I asked the patient, actually parents of the patients, to give him ketogenic diet, keto diet, where high fat, low carb diet that enhances ketone production, which reduces seizure occurrence. I asked them to include avocados, nuts, olive oil, fatty fish, and low carb vegetables. Also, I insisted the parents to take biofeedback therapy, which teaches individuals to control brainwave activity and prevent seizures. There were some emergency coping strategies during a seizure. What should you do by the parents? Stay calm and lie down in a sofa area. Turn to the side to prevent choking. During seizure, breathe deeply and avoid panicking. Also, use a cold compress on your forehead after the seizure subsides. Now, I will discuss about treatment protocol. Constitutional medicines, I used Cicotta virosa 10m. It is used for violent seizures, muscle spasms, and convulsions. Also, I had to prescribe Cuprum metallicum 200. It was administered to reduce the frequency and intensity of seizures, addressing neurological instability and spasms. As a therapeutic medication, I used Onantha crocata, in this specific case mother tincture. Why? This medicine Onantha crocata is known for its antispasmodic effects, used to reduce seizure severity and prevent recurrence. Also, for temporary management, in the initial stage, I used trituration medicines, strychnine sulf 3x and Plumba metallicum 3x, targeted to control tremors, spasms, and neuromuscular instability. And most of the doctors practicing neurology in homeopathy know that Plumba metallicum 3x is used to improve nerve conductivity and reduce muscular degeneration. Now, what was our treatment timeline and progress? In the initial phase, within 2 months, patient got symptomatic relief. Constitutional medicine Cicotta virosa 10m and Cuprum metallicum 200 were used alternating once a week. Therapeutic remedy Onantha crocata 20 drops once a day for 2 months, along with trituration medicine combination strychnine sulfuricum 3x and Plumba metallicum 3x, 3 grain spoonful each with a little bit water before going to bed. It was also continued for 2 months. Improvement observed. After the completion of 2 months, patient expressed seizure frequency decreased, seizures reduced from 2 to 3 times. It started only once a week. Post-seizure recovery also improved. Faster recovery from confusion and drowsiness. Muscle relaxation. Reduced spasms and involuntary jerks. In the intermediate phase, from 2 to 3 to 8 months, considerable improvement were observed. Medications administered same medicines, but I dropped trituration medicines at that time. Progression and observations. Seizure frequency decreased significantly. Seizures reduced to once every 2-3 weeks. Enhanced neurological stability. Reduced disorientation and faster cognitive recovery post-seizure. Better emotional control, emotional stability were also observed. Lesser irritability and fatigue. Improved motor control, muscle stiffness and tremor were significantly reduced. And hopefully, in the final phase, from 8 to 14 months, stabilization and completion, medications administered, therapeutic remedies and trituration medicines were withdrawn. Only constitutional medicines continued with the same doses. And we got final improvements like this. Seizure-free period. Patient remained seizure-free for the last 4 months of treatment. No neurological decline. Cognitive functions remained stable. Enhanced daily functioning. Patient resumed regular school activities without interruptions. He also got some emotional well-being, improved confidence, reduced anxiety, and better emotional regulation. In conclusion, my BrainMindia protocol proved to be a highly effective in the treatment of seizure disorder. We got symptomatic relief within 2 months, significant improvement by 8 months, complete stabilization and patient satisfaction by the 14th month. The patient, in this case, experienced complete symptomatic relief, a significant reduction in seizure episodes, and an overall improvement in quality of life. My BrainMindia protocol thereby demonstrated its efficacy in managing seizure disorder, offering a safe and effective treatment approach. Thank you.